السلام عليكم ورحمة الله وأهلا وسهلا فيكم في كورس Communication and Ethics.
قدم الله مقاصدنا وزال عنا جميع الهم.
السلام عليكم ورحمة الله وأهلا وسهلا بكم في استمرارية للمحاضرة السادسة. احنا الآن هنا إنه بدنا نعمل شوية ريفيجنز، حيعملنا شوية ريفيجنز. الآن مطلوب منك إنه راح أقرأ عليكم الآن الأسئلة مع الخيارات، واللي مطلوب منك على الموديل حيكون في عنا الأسئلة. طبعا هناك الأسئلة بس محطوطة صماء، يعني سؤال واحد سؤال اثنين سؤال، بس بدي الإجابة. واللقاء القادم إن شاء الله اللي حيكون سيكرونايزد راح نحكي على نراجع الأسئلة هذه ونراجع الإجابات والسبب اللي انحطت فيها هذه الإجابة أو الراشونال وراء كل إجابة. الحمد لله الذي علم بالقلم، علم الإنسان ما لم يعلم، والصلاة والسلام على خير معلم الناس الخير محمد. سموا بسم الله ولنبدأ نقرأ الأسئلة سويا. السؤال الأول: Which of the following is an example of non-verbal communication? Speaking clearly, smiling, listening actively, using appropriate tone. الآن اللي مطلوب منك بس على الورقة اللي موجودة على الموديل بدك تنزلها وتكتب اسمك عليها وهيك، بس تحط السؤال الأول الإجابة كذا. السؤال الثاني: Which of the following is an example of therapeutic communication? A. Interrupting a patient to correct their information. B. Changing the subject to avoid discussing a sensitive topic. C. Reflecting a patient's feelings about them. And D. Offering unsociated advice. Question number 3. Which of the following is a key component of activities? active listening. active listening. A. Interrupting the speaker to ask clarifying questions. B. Focusing on the speaker's body language rather than their words. C. Avoiding eye contact to avoid making speakers feeling uncomfortable. D. Paraphrasing the speaker words to ensure understanding. السؤال الرابع: Which of the following is an example of assertive communication? Aggressively demanding that a new patient follow their treatment plan. B. Apologizing for a medication error and offering to fix the mistake. C. Ignoring the patient's request for pain medication. And D. Blaming a coworker for mistake in front of others. برضو حتيجي على السؤال الرابع تحطي بس الرمز وترجع تحملها مرة ثانية على الموديل. السؤال الخامس: Which of the following is an example of a closed-ended questioning? A. What brings you to the hospital today? B. How have you been feeling lately? C. Can you tell me more about your symptoms? And D. Have you experienced this type of pain before? The closed-end questions فهذه في client nurse relationship. 6. Which of the following is an example of empathy في communication? Minimizing the patient concern and telling them they will be fine. B. Acknowledging patient's fear and offering support. C. Assessing a patient's cultural beliefs based on their appearance. D. Judging a patient for their lifestyle choice. 7. Which of the following is most important factor in establishing rapport with the patient? A. Using complex medical terminology. B. Maintaining eye contact. C. Interrupting their patient to clarify information. D. Speaking in a monotone voice. 8. Which of the following is an example of non-verbal communication? A. Giving a patient medication instructions. B. Making eye contact with the patient. C. Asking a patient about their medical history. And D. Documenting a patient's vital signs. 9. Which of the following communication techniques is most important for a patient who is hard of hearing? A. Speaking louder than more slowly. B. Using complex medical terminology. C. Writing down information. And D. Using a translator app on a smartphone. 10. Which of the following statement is an example of active listening? I am sorry, but I'm really busy right now. B. Can you repeat that? I did not quite catch what you said. He لازم what did you say? بس what you said. Let me tell you about a similar experience I had. I understand that you're feeling anxious about your surgery. ايش من هدول evidence على الاكتف listening اللي حتعمله النيرس في البوندنج relationship. Which of the following is an example of a closed-end questions? How are you feeling today? Can you tell me more about your symptoms? Do you have any allergies? What concern do you have about your treatment plan? 12. Which of the following communication techniques is most appropriate for a patient who is visually impaired? A. Using complex medical terminology. B. Speaking louder and more slowly. C. Using translator app or smartphone. Or D. Describing what you are doing and what the patient can expect to feel. 13. Which of the following is an example of therapeutic communication technique? Giving unasked advice to the patient, interrupting a patient to clarify information. C. Encouraging a patient to express their feelings. Or D. Criticizing patient choice or behavior. 14. Which of the following is an example of barrier to effective communication? Active listening, cultural differences, using open-ended questions, maintaining eye contact. 15. Which of the following is the best definition of therapeutic communication? A form of communication used to build social relation. A type of communication used to maintain and control others. C. A way of communicating that help patients feel heard and understood. D. Methods of communication that focus solely on providing medical information. سؤال 16. What is the most important skill for effective communication in nursing? A. Active listening. B. Providing information. C. Using medical jargon. And D. Giving advice. سؤال 17. Which of the following is an example of non-verbal communication using medical terminology? Provide information about medication, making eye contact, asking a closed-end questions. 18. Which of the following is an example of closed-ended question? What bring you to the hospital today? How long have you been experiencing these symptoms? Can you tell me more about what you are feeling? Do you have any allergies? 19. Which of the following is an example of reflective listening? Reflective listening. A. Repeating back medical information to the patient. B. Paraphrasing the patient words to show understanding. C. Interrupting the patient to provide advice. D. Asking closed-ended question to clarify information. سؤال 20. Which of the following is an example of empathetic communication? A. Telling the patient what they need to do. B. Asking closed-ended questions. C. Providing medical information. D. Expressing understanding and compassion. And سؤال 21. Which of the following is an example of assertive communication? A. Agreeing with a patient concern to avoid conflict. B. Yelling at a patient who is not following medical advice. C. Using I statement to express your needs and feelings. And D. Avoiding conflict of remaining silent. والسؤال الأخير. Which of the following is an example of cultural competency using medical jargon to communicate with a patient, stereotyping patients based on their ethnicity, understanding and respecting cultural differences, assessing that all patients have the same value and beliefs. بناء عليها لما نفهم نجاوب هذه الأسئلة إن شاء الله، لذلك بيكون هذا هو الجزء الأخير من المحاضرة السادسة اللي تركزت بشكل أساسي على فهم الكوميونيكيشن باترنز ما بين two parts، واللي أنا هون الفوكس تاعي كان هو النيرس to patient. سبحانك اللهم وبحمدك، نشهد أن لا إله إلا أنت، نستغفرك ونتوب إليك. نتمنى من الجميع الإجابة على هذه الأسئلة باستخدام منصة مودل. طبعا المنصة راح تظل فاتحة ليوم الخميس. هذا عبدالكريم ابلاسي يحييكم، والسلام عليكم ورحمة الله. طبعا الوقت المتوقع لإنهاء هذه الاكسرسايز على المنصة هو 20 دقيقة، فأتمنى إنه ما يعني نحاول كل واحد فيكم بس يحاول يشوف قديش باخذ منه قبل ما يجاوب الأسئلة أدناها أو الأسئلة.